everyone, we are from Group 4 and today we will explain about ghrelin. So what is ghrelin? Ghrelin is a multifaceted intestinal hormone secreted from the stomach to stimulate appetite and the release of growth hormone. Ghrelin levels are primarily regulated by food intake. Levels of ghrelin in the blood rise just before eating and when fasting, with the timing of these rises being affected by our normal meal routine.
There are 4 functions produced by ghrelin. First, regulation of food intake. Based on research, ghrelin given intravenously to humans contributes to increased appetite and enhancement of food intake. Ghrelin is pulsated as its level increases before start of the meal, during fasting, and decreases after feeding. Second, energy metabolism. Ghrelin is involved in the regulation of long-term weights. Ghrelin levels will decrease with weight gain due to different conditions such as overfeeding, pregnancy, or high-fat diet. Conversely, ghrelin levels increase with weight loss due to conditions such as dietary restriction, long-term chronic but not acute exercise, catching conditions caused by anorexia nervosa, severe congestive heart failure, lung cancer, and breast and colon cancer. Third, bone formation. Bone formation is caused by ghrelin, which induces osteoblastic cell proliferation and differentiation, prevents cell apoptosis, and increases bone mineral density. Fourth, modulation of cardiovascular function. Ghrelin reduces the mean arterial pressure without altering the heart rate in healthy subjects. In patients with chronic heart failure, ghrelin improved left ventricular function, increased cardiac production and heart index, decreased systemic vascular resistance, and increased muscle strength.
So, with that information, we know that ghrelin is a hunger hormone. Therefore, it must remain stable in order to prevent it from getting too much or too little in our bodies, which may lead to many health problems. There are ways in which we can keep our ghrelin levels in check by improving our eating habits. Firstly, we should consume food that contain omega-3 like fatty fish, chia, or flax seeds, as well as protein, especially during breakfast, to reduce ghrelin levels and promote satiety. Lastly, it is also important to avoid consumption of sugar, as it can impair ghrelin response after a meal.